Greetings, everyone. Let's welcome to another great video here at brought to you by Stowell Healthcare. My name is Emmanuel. I'm your revenue cycle manager. I'm here to present to you another great video. In this video, I'm gonna present to you it's another exclusive of Stowell Healthcare. It's a very quick introduction to Medicare as a payer, which is Medicare, which one of the nation's largest health insurance funded by the federal government. I want to take a few minutes to present to you, a little bit about Medicare. Let's take a look. We're not going to take too much time. I like to keep these little mini clinics videos well under 5 minutes. Let's take a look here. Thank you. Medicare, we'll say it's a national health insurance program here in the States, and it was enacted by the government here in 1965 under the Social Security Administration Act, which here we have, I want to say, I believe it was Lyndon Johnson who introduced this, and it's actually for patients who are either under the age of 65 or who can be under age of 65 that are disabled and so forth. And it is sponsored by the CMS, which is the Center of Medicare and Medicaid. Some facts about Medicare. Medicare eligibility: you must be a U.S. citizen or lawful permanent resident. As discussed, we said here, you have to be at least 65 or older, or you can be younger with a permanent disability or blindness. So you have patients who's HIV, who has kidney failure and so forth. They are eligible for Medicare they are eligible for Medicare. And type of Medicare plans: Medicare Part A covers inpatient hospital. Medicare Part B, outpatient doctor's office visit and durable medical equipment. We have Medicare Part C, which is responsible for both, which is sponsored. It's sponsored by the government, but it's actually administered by private health insurance, such as United Healthcare or Blue Cross Blue Shield or Cigna and so forth. And for this type of Medicare Part C, they cover A, B, and D all together, all at one time. Medicare Part D, which is for prescription, the government determines your eligibility, but it's administered by private health insurance, such as Humana or WellCare and so forth. Medicare Part B can also be as a secondary payer to a group health insurance. So meaning that you may be eligible for Medicare, you are enrolled. However, if you or your spouse still working, then that health insurance become primary and Medicare becomes secondary. Or let's take a step back. Or if you are in a motor vehicle accident or it's a workers' comp case, where Medicare can become a secondary payer to your workers' comp case or to your MVA case. So Medicare become a secondary payer. Let's take a look. Medicare Part A. Medicare Part A, as discussed here, we said Medicare Part A cover inpatient hospital care, skilled nursing facilities, nursing home. That is not custodial or long-term care. So if a patient SNF or hospice care and the patient is enrolled under a Medicare Advantage plan, you need to change it to Medicare Part. If the patient present in the doctor's office visit, you need to build a Medicare Part B for benefits. Home health care Part A covers. Let's take a look at Medicare Part B. Doctor's office visit. Notice here, not to be confused with inpatient. While inpatient room and board charges, this is doctor's office visit. When the patient, let's say you are admitted in the hospital and you have a doctor, a cardiologist, or an ophthalmologist, or whatever the type of specialty, or nephrologist that goes sees you while you are listed as an inpatient, we bill Medicare Part B. Outpatient surgical, clinical lab tests and x-ray, durable medical equipment, chemotherapy, and Part B drugs. Part B drugs, I spent over 12 years of my career in ophthalmology, and we bill a lot of Medicare Part B for a lot of our retina drugs such as Eylea, Lucentis, Vabysmo, Avastin, and so forth. And then we also have some preventive services that is covered under Medicare Part B also. But Medicare Part B, since I just discussed ophthalmology and optometry care services, Medicare does not cover routine eye exam. If you're over the age of 65, you have Medicare Part B. Routine eye exam is not a covered service under Medicare Part B. However, glasses covered after post-cataract or retinal surgeries, you can bill the debunked for durable medical equipment for glasses post-cataract services. They do cover for that. Let's take a look at what the original Medicare card looks like. It's that blue, white, and red card. Again, it has the patient's name, ID, the effective date. Again, this is an original old card. I'm just using this as a sample for you to present to you so you get an idea. Again, this patient here says Part A only. So if this patient present in the doctor's office visit, this patient would not have any benefit because it does not have Part B. This is only this patient as soon they turn 65, most likely they will receive this card, and it would only be used for the patient to be admitted in the hospital for room and board charges. Again, this patient here, eligible for both Medicare Part A and Medicare Part B with an effective date, the alphanumeric, which is the new model of the Medicare ID, followed by the patient's name. Again, I'm using this as simple just for educational purposes. Again, this is not actual patients or the actual card. This is just to train you into what the card encompasses so you can get a general idea of what you're looking at when you're looking at the patient's card. And for those of you who are in India, Bangladesh, or Pakistan, or Saudi Arabia, Qatar, and so forth, my international students or partners, my best is to make you a revenue cycle managing expert because you showed a lot of interest in learning about the revenue cycle, whether you're going to start your own company or you already working for a company, you need more information, you need to be trained. This is what we're here for at Stowell Healthcare. And we're also taking new clients here in the States, in the New England area. We're actually taking new clients. The phone's being ringing, and we're going to continue to service our clients here in the States as we are a US-based company here in the United States. Let's take a look at this one here is Medicare, Railroad Medicare, which give you a separate benefit. This is sponsored by Railroad Retiree or somebody else who sponsored them to be in it, their family members and so forth. This year, I'm usually billing this to Palmetto. I believe it's in South Carolina. Palmetto Medicare, it's who's responsible for the contracts to administrate the benefits here. Again, it looks just like the Medicare Part B card, the previous card that I showed you here, except it has the railroad information here. So again, railroad Medicare, it's you use a separate contractor to build a claim out rather than the original. Based on the region, you have about 6 contractors who's responsible. The government does grant the contracts to be administered by different groups and different companies. And here on my region is the NGS. You have Noridian, you have Palmetto, you have I want to say Novitas, and so forth. Some of the audits come from different groups. Everyone is responsible for something different, but they're all working with the government to make sure all the beneficiaries receive benefits and claims get paid. Let's take a look at some service that's not covered by Medicare. As we just talked about, we have routine dentures and dental care, routine eye exam, most alternative care, hearing aids examination, routine food care. Again, when it says routine, if you have something, a disease associated with the service, example, if someone has glaucoma, they have cataracts and so forth, that is not routine. Routine is more associated for basic service where there is no systematic disease or manifestation of a medical disease associated with it. So it's imperative you understand that. It also says some preventive, some chemotherapy and Part B drugs. Care outside the United States is not covered. In Puerto Rico, they do have their own Medicare and their own Medicare Advantage and HMO plans in Puerto Rico. I think we covered a lot, and Medicare is one of the biggest payers here in the States. If you take in any part of the revenue cycle, it's imperative you understand the role of Medicare, CMS, and the Center of Medicare and Medicaid. I just quickly present to you Medicare as a payer. If you want to learn more, or if you have any questions, you want me to give you the full spectrum of this training for Medicare Part B, you are to inbox me, contact me. I'll be more than happy to share any information that we have here at Stowe Healthcare. We are your revenue cycle company. Thank you for stopping by the platform. My name is Emmanuel. Stay tuned for the next video. We're going to continue to bring you mini video like this into our revenue cycle mini clinics. And thank you and have a good day. Always leave a comment, liking the video, sharing the video, and sign up for our channels. Thank you.